every 66 seconds, another American develops Alzheimer's disease. By the time this video ends, many more families will be facing questions they never expected to ask. For many people, age is certainly one factor, but in some cases, another contributor has been hiding in plain sight. A medication sitting quietly on the bathroom shelf, taken every single day because it was prescribed or purchased over the counter. I'm Dr. William. After more than 15 years of caring for older adults, I've watched this story unfold far too many times. Someone who had always been sharp begins forgetting names, missing appointments, or getting turned around on a familiar drive home. Family members often assume it's simply part of getting older. Sometimes it is, but sometimes it isn't. Sometimes the medication meant to help one problem is quietly affecting the brain in ways neither the patient nor their family expected. That's why today's video matters. Today, we'll walk through 9 commonly used medications that research has linked with memory problems or cognitive decline in some older adults. We'll count down from number 9 to the medication-related issue I believe deserves the most attention. And pay close attention to number 3. It's prescribed to millions of people for a condition that sounds completely routine, yet research over the past several years has raised important questions about how it may affect memory in some older adults. Before we begin, one important reminder. This video is for educational purposes only. Never stop or change a prescription medication without first speaking with the healthcare professional who prescribed it. Many of these medications provide important benefits, and for some people they remain the best treatment available. The goal isn't fear, it's awareness, informed conversations, and safer decisions made together with your healthcare team. Now I'd love to hear from you. Tell me your age range in the comments, 50s, 60s, 70s, 80s, or beyond, and approximately how many medications you take each day. Reading your experiences helps me understand which topics would be most valuable in future videos. Now, let's begin with number 9. Don't let its place on the list fool you. This medication sits in medicine cabinets across America, and because it's available without a prescription, many people never imagine it could affect the brain at all. Number 9. Diphenhydramine Benadryl. Most people know it as Benadryl, the little pink pill taken for allergies, a cold, or simply to help with sleep. It's inexpensive, it's easy to find, and because it's sold over the counter, many people assume it's completely harmless for long-term use. The reality is more complicated. Diphenhydramine belongs to a group of medications called anticholinergics. You don't need to remember that name. Here's what matters. These medications block a brain chemical called acetylcholine. Think of acetylcholine as part of your brain's messaging system. It helps different parts of the brain communicate with one another so you can stay alert, learn new information, and form new memories. Imagine trying to have a conversation while someone keeps interrupting every sentence. The conversation still happens, but it's slower, more confusing, and much easier to lose track of. That's similar to what can happen when this important communication system is repeatedly blocked. As we get older, our brains naturally become more dependent on this system working efficiently. That's one reason medications that interfere with it may affect older adults more than younger people. Researchers believe this is especially important in the part of the brain responsible for creating new memories. I've cared for many patients who took a nighttime antihistamine for years without ever suspecting it could be contributing to increasing mental fog. They blamed stress, poor sleep, or simply getting older. Only later did they discover their medication might have been part of the picture. Several observational studies have found that people who regularly use strong anticholinergic medications over long periods are more likely to develop cognitive decline or dementia than people who do not. These studies cannot prove the medication directly caused the problem. However, the findings have been consistent enough that many geriatric specialists recommend limiting long-term use, whenever safer alternatives are appropriate. So here's one simple thing you can do tonight. Take a look at the labels on any medication you use for sleep, PM, pain relief, or allergy symptoms. Many contain diphenhydramine under different brand names. If you rely on it regularly, ask your healthcare professional whether a newer antihistamine, such as loratadine or cetirizine, might be a better option for your situation. These medications are generally less likely to affect the brain and are often preferred for many older adults. The goal isn't to stop medication on your own. It's to make sure you're using the safest option for both your brain and the rest of your body. And that brings us to number 8. This next medication doesn't act on the brain directly like Benadryl does. Instead, it quietly changes something your brain depends on every single day, and most people never realize it's happening. And that brings us to number 8. This next medication doesn't act on the brain directly like Benadryl does. Instead, it quietly changes something your brain depends on every single day, and most people never realize it's happening. Number 8. Proton pump inhibitors. The names include omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These medications are among the most commonly used treatments for heartburn, acid reflux, and stomach ulcers. For many people, they're extremely effective. The problem isn't usually taking them for a few weeks. The concern is when they quietly become a medication that's taken every day for years without anyone asking whether it's still needed. Here's why. Your stomach doesn't produce acid just to cause heartburn. That acid also helps release important nutrients from the food you eat. One of the most important is vitamin B12. Vitamin B12 plays an essential role in keeping your nerves healthy and helping your brain function properly. Imagine trying to power your home with weak electrical wiring. The lights may still turn on, but they begin to flicker. Some rooms don't work quite as well. Over time, the whole system becomes less reliable. That's similar to what can happen when your body doesn't absorb enough vitamin B12. Research has shown that long-term PPI use can reduce B12 absorption in some people. Low B12 levels have been linked to problems such as fatigue, numbness, balance difficulties, and memory changes. Scientists have also studied whether long-term PPI use itself may be associated with dementia. Some observational studies have reported a higher risk, while others have found little or no association. At this point, researchers haven't established that PPIs directly cause dementia, and the relationship remains an active area of investigation. What is well established is that people taking these medications for long periods should periodically review whether they're still necessary. So here's something practical. If you've been taking a proton pump inhibitor every day for months or years, ask your healthcare professional whether it's still the right treatment for you. Some people truly need these medications long-term. Others may be able to use a lower dose, take them for shorter periods, or switch to another treatment, depending on the cause of their symptoms. The important thing isn't stopping the medication yourself. It's making sure you're taking the lowest effective dose for the shortest appropriate time. Sometimes a simple medication review is all it takes. Now let's move to number 7. This medication is prescribed for a problem that millions of older adults experience, but few enjoy talking about. Number 7. Oxybutynin and other bladder medications. If you've ever had to plan your day around knowing where every restroom is, you understand how disruptive an overactive bladder can become. It can affect travel, shopping, family outings, even getting a full night's sleep. That's why medications like oxybutynin, sold as Ditropan, have helped many people regain confidence and independence. But there's an important trade-off many patients are never told about. Like Benadryl, oxybutynin belongs to the anticholinergic family of medications. That means it also blocks acetylcholine, the same brain communication system we talked about a few minutes ago. Imagine turning down the volume on a radio. At first, you can still hear the music. Turn it down a little more. And eventually, you begin missing pieces of the song. Researchers believe something similar may happen when acetylcholine is repeatedly blocked over long periods. I've spoken with older adults who thought they were simply becoming forgetful. They described missing appointments, walking into a room and forgetting why they were there, misplacing the same set of keys several times in 1 week. Many assumed it was simply age. Only later did they learn their medication might have been contributing. Several large observational studies have found that long-term use of strong anticholinergic bladder medications is associated with an increased risk of cognitive decline and dementia. Again, these studies cannot prove cause and effect, but the findings have been consistent enough that many geriatric specialists now recommend considering alternatives whenever appropriate. The encouraging news is that treatment options have improved. Newer medications, such as Murabagrin, work through a different biological pathway and generally don't block acetylcholine. For some people, they may provide similar bladder control with less concern about cognitive side effects. They're not right for everyone, but they're certainly worth discussing if memory changes have become a concern. The important message is this: you shouldn't have to choose between bladder control and protecting your brain. The best treatment is the one that considers both. Coming up next is a medication almost everyone has heard of. Millions of Americans take it every morning to protect their heart. But some people have wondered whether it may also affect the brain. Let's take a careful look at what the evidence actually shows. And that brings us to number 6. This medication may be the most surprising one on today's list. Not because it's rarely prescribed, but because it's one of the most commonly prescribed medications in the world. Number 6. Statins. Names like atorvastatin, sold as Lipitor, and simvastatin, sold as Zocker, are familiar to millions of Americans. For many people, these medications reduce the risk of heart attack and stroke and can be life-saving. So let me be very clear. This is not a reason to stop taking a statin. It's a reason to understand both the benefits and the questions researchers continue to study. Your brain contains a large amount of cholesterol. Not the cholesterol floating through your bloodstream, but cholesterol that's naturally made inside the brain and helps build healthy nerve cell membranes. Some researchers have wondered whether certain statins, particularly those that cross into the brain more easily, might affect thinking or memory in some people. The evidence has been mixed. Some studies have reported temporary memory problem in a small number of patients. Others have found no meaningful effect. And several studies suggest statins may actually reduce dementia risk by lowering the risk of stroke and improving overall vascular health. That's why major medical organizations continue to recommend statins for people who clearly benefit from them. Still, every person is different. I've cared for patients who felt mentally foggy after starting one medication, while others noticed no change at all. The important question isn't whether statins are good or bad. It's whether the medication, the dose, and the individual patient are the right match. If you've noticed new memory problems after starting or increasing a statin, don't stop taking it on your own. Instead, talk with your healthcare professional. Sometimes a lower dose, sometimes switching to a different statin, or sometimes discovering that something completely unrelated is causing the symptoms. That's why an individual evaluation matters. Protecting your heart and protecting your brain should always go hand in hand. Now let's move to number 5. This next group of medications can feel like a lifeline when anxiety becomes overwhelming or sleep seems impossible, but they also require some of the greatest caution. Number 5, benzodiazepines. Medications such as lorazepam Ativan, diazepam Valium, and alprazolam Xanax have helped countless people through periods of severe anxiety, panic attacks, and insomnia. When they're first prescribed, many people describe an overwhelming sense of relief. The racing thoughts slow down. The tension eases. For the first time in weeks, they finally sleep. It's easy to understand why these medications can become difficult to give up. But the brain also adapts to them. Over time, many people need higher doses to achieve the same effect, while others begin noticing slower thinking, reduced concentration, or increasing forgetfulness. Large observational studies have found that long-term benzodiazepine use is associated with a higher risk of cognitive decline and dementia in older adults. Researchers are still working to understand exactly how much of that relationship is caused by the medication itself, and how much may reflect the conditions the medication was prescribed to treat. Even with that uncertainty, many geriatric experts recommend using these medications at the lowest effective dose for the shortest appropriate duration whenever possible. One reason is that they don't simply affect memory. They can also increase the risk of falls, fractures, daytime drowsiness, and motor vehicle accidents, particularly in older adults. Here's something many people don't realize. Stopping a benzodiazepine suddenly can be dangerous. The body becomes physically accustomed to these medications. Abrupt withdrawal may cause severe anxiety, tremors, dangerous spikes in blood pressure, seizures, or other serious complications. That's why these medications should never be stopped without medical guidance. If you've been taking one for weeks, months, or years, speak with your healthcare professional before making any changes. A gradual tapering plan is often the safest approach. Depending on the reason it was prescribed, other options may also help. Some people benefit from cognitive behavioral therapy for insomnia or anxiety. Others may respond well to different medications that carry less risk of cognitive side effects. The right answer depends on your individual health history. One thing is certain: no medication should quietly remain on your prescription list year after year simply because no one has reviewed whether it's still needed. And that's exactly what makes our next medication so concerning. Many people don't even realize it's one of the strongest anticholinergic medications still commonly. And that brings us to number 4. This next medication is prescribed for several completely different reasons: sleep, chronic nerve pain, migraine prevention, depression. That versatility is exactly why so many older adults have taken it at one time or another. Number 4, amitriptyline. Amitriptyline is an older antidepressant that's still commonly prescribed today. For many people, it provides real relief. The concern isn't that it never works. The concern is how it works. Like several medications we've already discussed, amitriptyline has strong anticholinergic effects. That means it blocks acetylcholine, the same brain communication system involved in attention, learning, and memory. Imagine trying to build a puzzle while someone keeps removing a few pieces every minute. You might eventually finish, but it becomes slower, more frustrating, and much easier to make mistakes. Researchers believe that repeatedly blocking this system over long periods may contribute to cognitive problems in some older adults. Large observational studies have found that people with the greatest long-term exposure to strong anticholinergic medications, including amitriptyline, have a higher risk of developing dementia than those with little or no exposure. These studies cannot prove the medication directly caused dementia, but the association has been strong enough that many geriatric guidelines recommend considering safer alternatives whenever appropriate. If you're taking amitriptyline, don't stop it on your own. Instead, ask your healthcare professional whether another medication might meet your needs with fewer cognitive concerns. Sometimes the answer is yes. Sometimes it isn't. The important thing is making that decision together. Now we come to the medication I asked you to watch closely. Number 3, paroxetine Paxil. Paroxetine belongs to a group of antidepressants called SSRIs. Most medications in this family have relatively little anticholinergic activity. Paroxetine is different. It has significantly stronger anticholinergic effects than other commonly prescribed SSRIs. That difference matters, especially for older adults. Several studies have found that older adults taking paroxetine may experience more problems with memory, attention, and thinking than people taking certain other SSRIs. Because of these concerns, the American Geriatric Society includes paroxetine on the Beers criteria, a list of medications that often deserve extra caution in older adults. That doesn't mean everyone taking paroxetine should stop. Far from it. For some people, it remains the right medication. But if memory changes have become noticeable, it's worth asking whether another SSRI, such as sertraline or escitalopram, might provide similar benefits with less concern about cognitive side effects. That conversation should always happen with the healthcare professional managing your treatment. Now we're down to the final 2. And this next one concerns me deeply, not because it's always inappropriate, but because it's sometimes prescribed for reasons that deserve careful review. Number 2, antipsychotic medications. Medications such as quetiapine, risperidone, and olanzapine were developed to treat serious psychiatric illnesses like schizophrenia and bipolar disorder. For those conditions, they can be life-changing. But over the years, they've also been prescribed off-label for problems such as agitation, severe behavioral symptoms, or insomnia in some older adults. These medications can be appropriate in carefully selected situations. However, they also carry significant risks. Research has shown that in older adults, particularly those living with dementia, antipsychotic medications are associated with a higher risk of stroke, falls, excessive sedation, and even increased mortality. They can also affect thinking, attention, and overall cognitive function. Families sometimes describe a loved one becoming unusually withdrawn, sleeping much of the day, or simply seeming less like themselves. If someone you care about is taking one of these medications, ask an important question. What was the original reason this medication was started? And equally important, does that reason still exist today? Sometimes the answer is yes. Sometimes the medication is still providing meaningful benefit. But if no one has reviewed it in months or even years, that conversation is worth having. Because now we've reached the most important point in this entire video. Number 1, anticholinergic burden. You may have expected one final medication. Instead, number one is something far more common. It's what happens when several medications, each with a small anticholinergic effect, are taken together. Imagine carrying a backpack. One book doesn't feel heavy. Neither do two, or even three. But keep adding books, and eventually the weight becomes impossible to ignore. That's what researchers call anticholinergic burden. One medication may have only a modest effect, but when several medications all interfere with the same brain communication system, those effects can add together. Many older adults don't realize they're taking more than one anticholinergic medication: a nighttime sleep aid, a bladder medication, an antidepressant, an allergy pill. Individually, each may seem harmless. Together, they may place a much greater burden on the brain. Several large observational studies have found that people with higher cumulative anticholinergic exposure are more likely to experience cognitive decline and dementia over time. These studies don't prove the medications are the sole cause, but they do suggest that reducing unnecessary anticholinergic exposure may be one practical way to help protect brain health. Here's the encouraging news. Medication-related cognitive problems can sometimes improve after unnecessary medications are reduced or replaced under proper medical supervision. Not in every case, but often enough that it's worth asking the question. And that's the message I hope you remember from today's video. Don't assume memory problems are just getting older. Don't assume every medication is still necessary simply because you've taken it for years. And never make changes on your own. Instead, schedule a medication review with your doctor or pharmacist. Bring every prescription, every over-the-counter medication, every vitamin, every supplement. Sometimes the most important treatment isn't adding another medication. It's making sure you still need the ones you're already taking. Now I'd like to hear from you. Which of these medications surprised you the most? Have you ever had a medication reviewed because of memory concerns? Share your experience in the comments. Your story may encourage someone else to ask an important question at their next appointment. And before you leave, today's video focused on what may be hiding in your medicine cabinet. But your body has other ways of revealing important clues about your health. Believe it or not, your fingernails can sometimes provide early warning signs of problems involving your circulation, nutrition, and overall health. In the next video, I'll show you 4 nail changes every older adult should know how to recognize, and what they may be trying to tell you. Until then, take care of yourself, stay curious, and I'll see you in the next video.